Our next guest is helping to lead a movement aimed at reducing the disproportional number of African American child deaths. It's a sad reality, but Kindra Montgomery-Block is working to do just that with the Black Child Legacy campaign. Welcome to the show, Kindra.
Well, thank you for having me. It's really great to be here this morning.
Well, on your website, it says in Sacramento County, African American children die at twice the rate of any other ethnicity, and that there are 4 leading causes. Let's start with the first one. It's perinatal conditions. Can you elaborate on that?
Yeah, perinatal conditions really is that period of about 0 in your womb to about 3 months after birth. And as Black women, we do not have healthy birth outcomes for ourselves and our bodies and for our families. And so perinatal conditions covers that. And we're working really hard to change some of the systemic pieces that are in our hospital systems and our clinic systems to be able to change that.
You also talk about infant sleep. How's that impacting young Black children?
Yeah. So, like you said, the second cause of death is sudden unexplained infant death. Some of us must know that as SUED's death. And we know that African American children, babies, infants, and their families really do like to co-sleep. And one of the things we are consistently saying and building a strategy that really combats SUED's death is by making sure that your babies, when they're infants, are alone, on their back, and in a crib. We call that the ABCs of sleeping.
Yeah, I know when I was a new mom, those things, they just run through your mind, and you can never just really be relaxed. You always have to think about those things, especially when they're sleeping. You're like, are they still breathing? Are they okay? So I know it is a big deal when they go to sleep. Next is child abuse and neglect, which no child should ever go through, but you're saying it is more prominent in the Black community.
Yeah, and so in Sacramento County, what we do know about child abuse and neglect is that it disproportionately affects African American families and children. And so child abuse and neglect deaths are deaths by parents, caretaker, or guardian. And unfortunately, in Sacramento County, it disproportionately affects African American families. But we're working hand in hand to create cultural broker strategies that really work alongside child protective services and communities that have been largely affected to make sure that we have the right cultural connections and opportunities to help these families in crisis. And we've been really impactful in all of the areas, but really proud of the partnership with Kim Pearson and Michelle Cajas at Sacramento County Department of Children, Family, and Adult Services.
Well, I think it's really great, some of the work you're doing to bring more attention to these issues and the problem. Another issue that comes up that's contributing to some of these numbers in Sacramento County is party homicides. Can you explain exactly what that means?
Yes, third-party homicides as it relates to the Black Child Legacy campaign and reducing preventable child deaths is death by third-party gun violence. And so for us, that really is gangs and the really unsafe conditions that are currently kind of an uptake in violence in our neighborhoods, our most vulnerable neighborhoods in Sacramento County. We're working really hard to put prevention strategies that are both related to COVID-19 and connect the dots around the root causes of violence and get folks that have, again, that credible messaging, the opportunity to create cultural brokers in these neighborhoods like never before. And we're proud of what we've been able to do in the past, pre-COVID, and really moving into a strategy that amps up our efforts.
Kendra, you've mentioned now some of the issues. You explained what they are that are contributing to this death rate. And you have the Black Child Legacy campaign. Talk about how that's addressing some of these issues.
Right. So again, the goal of the Black Child Legacy campaign is to reduce preventable African American child deaths by 10 to 20% by the year 2020. I am proud to convey to you and your viewers that we have been well beyond that initial goal. We've met that by 25%. And so by working on these 4 issues, we've been able to be targeted but universal in our approach, much like the work of John Powell at UC Davis and the othering and belonging. But what we know is that universal universal approaches don't work, but targeted interventions have the opportunity to really rise all boats. And so when we think about the Black Child Legacy Campaign and what we've been able to do in third-party homicide is really not just say that there's been zero juvenile homicides pre-COVID for the last 30 months. It's not just Black kids, it's all kids. And that's what target universal strategies really can do for our public health crises.
And you have a slogan, healing the hood. Can you tell us what that is?
Again, we really strongly believe that it takes community to save community. And Healing the Hood, again, is our third party gun violence prevention, violence reduction efforts here in the Sacramento County. Have been wildly successful. And part of what Healing the Hood really does is create an umbrella strategy for a lot of intervention, prevention, and violence interruption organizations to come together to build collective responsibility, understand our lanes, and work alongside each other. And we've been really successful at that. And that is why the City Council and the meeting last week, we were able to not only present our data and our facts, but also present our unity as a coalition. And that's what Healing the Hood is. Violence prevention, intervention, and interruption. And it's working in Sacramento County.
Well, that's great to hear. Can you tell us what's next for the Black Child Legacy Campaign?
Yeah, what we have heard and what we have witnessed, and I know that you all being a news organization, there has been a strong uptake in gun violence, youth homicides since COVID. What we know is that because the root causes of violence are really poverty, intergenerational struggle, as well as intergenerational struggle, and as well as just the systemic racism pieces that really create vulnerability in our most vulnerable neighborhoods. And so our goal continues to be to strengthen those neighborhoods from the inside out, to provide those individuals and families that might be in violent crises with the right strengths and opportunities and resources to come up out of that crisis. And we're really proud of our on-the-ground street outreach work, but we're also proud of the collaborative pieces that we have with Kaiser and UC Davis Med Center to make sure we can meet those families that are in those middle of those crises where they're at. And there's a lot of strategies that we can get into, but what you should know is that the City Council backed our plan last week to be able to double down on what we know has been working, and to be able to amp up those resources during this pandemic, and to provide those young people with the touch and innovation like we've never had before, because we're in a new era.
Kindra, we want to thank you so much for coming on the show this morning and sharing information about your efforts. And you can learn more about Black Child Legacy Campaign at blackchildlegacycampaign.org.